Your hands and feet never take a day off, so take care of them. Anonymous. Low 1. Explain why cosmetologists need to understand nail structure and growth. Why study nail structure and growth? The appearance of your client's nails is integral to their overall image as well as an important indicator of their general health. The goal of all nail services should be to help clients achieve and maintain healthy, strong, well-groomed nails. To provide professional nail services for clients, you must first learn about nail structure and growth. Cosmetologists should have a thorough understanding of nail structure and growth because understanding natural nail structure and growth allows you to expertly groom, strengthen, and beautify nails. You must know the difference between the nail cuticle and the eponychium before performing nail services. Understanding natural nail structure and growth cycles prepares you for advanced nail services. Check-in 1. Why should cosmetologists be knowledgeable about nail structure and growth? Low 2. Define the natural nail unit. The natural nail unit. The natural nail unit includes all parts of the finger from the tip to the first knuckle. The natural nail is technically referred to as the onyx and is composed mainly of keratin, the fiber-shaped protein found in skin and hair. The keratin in natural nails is more durable than the keratin in hair or skin. A healthy nail is firm and flexible, shiny, and slightly pink. Its surface is usually smooth and unspotted, with no splits or deep grooves. A healthy nail is translucent, with the nail bed's pinkish or beige color showing through. Check-in 2. What is the technical term for the natural nail? 3. Natural nails are comprised mostly of what protein? 4. Describe the appearance of a healthy nail. Low 3. Label nail structures. Nail structures. The natural nail is divided into several major parts, including the nail folds, proximal nail fold, nail plate, nail bed, matrix, cuticle, eponychium, hyponychium, and specialized ligaments. Together these parts form the natural nail unit. Figure 5.1. The nail bed, nail fold, eponychium, perionychium, and hyponychium are collectively referred to as the perionychium. Nail folds. Nail folds are skin folds that surround the nail plate. These folds form the nail groove on the nail sides. The lateral nail fold, also known as the sidewall, is the skin fold overlapping the nail side. Proximal nail fold, PNF. The proximal nail fold, PNF, is the entire skin flap covering the matrix, extending from the visible nail plate's edge to the first joint of the finger or toe. This tissue folds back underneath itself to create a tissue flap that shields and protects this sensitive area. Keratinized proximal nail tissue is where the nail matrix exists. Cells proliferate inside the matrix and keratinize to form the nail plate. Proximal nail plate. The nail plate is the hardened keratin plate that sits on top of the nail bed. It is the most visible and functional part of the nail unit. It is formed by the matrix cells, whose sole job is to create nail plate cells. While it appears to be one solid piece, it is constructed of approximately 100 nail cell layers. As it grows, the nail plate slowly slides across the nail bed. The free edge is the part of the nail plate that extends over the tip of the finger or toe. The nail plate is relatively porous to water, meaning it can absorb some moisture. The water content of the nail is related to the surrounding environment's relative humidity. A healthy nail may look dry and hard but has 15 to 25% water content. The water content directly affects the nail's flexibility. The lower the water content, the more rigid the nail becomes. Using an oil-based nail conditioner or nail polish to coat the plate can reduce water loss and excessive water absorption and improve flexibility. Nail bed. The nail bed, also known as sterile matrix, is the portion of living skin that supports the nail plate as it grows toward the free edge. Because it is richly supplied with blood vessels, the area under the nail plate can have a pinkish appearance in the area that extends from the lunula to the area just before the nail's free edge. The nail bed contains many nerves and is attached to the nail plate by a thin tissue layer called the bed epithelium. The bed epithelium helps guide the nail plate along the nail bed as it grows. You must understand the differences and use the proper names for the parts of the nail unit. For example, nail polish is applied to the nail plate, not the nail bed. Matrix. The matrix is where the nail plate cells are formed and extends from under the nail fold at the nail plate's base. It is composed of matrix cells that differentiate, become specialized cells to perform specific tasks, and become keratinized to form the nail plate. The matrix area contains nerves, lymph, and blood vessels to nourish the matrix cells. As long as it is nourished and healthy, the matrix continues producing new nail plate cells. The visible part of the matrix that extends from underneath the living skin is called the lunula. It is the whitish, half-moon shape underneath the nail plate's base. This appearance is caused by the reflection of light off the surface of the visible part of the underlying nail matrix. The lunula's lighter color shows the true color of the matrix. Everyone has a lunula, but not all lunulas are visible. Some are short and remain hidden under the PNF. Poor health, such as due to disease or nail disorder, or a matrix injury, can affect the nail plate's growth. Cuticle. The cuticle is the non-living colorless tissue attached to the nail plate and comes from the eponychium located on the underside of the skin lying above the natural nail plate. The cuticle becomes strongly adhered to the nail plate while still underneath the PNF and pulls away and adheres to the nail plate's upper surface as it grows outward. The cuticle forms an important seal between the PNF and nail plate. This prevents infectious organisms from getting underneath the skin and infecting the matrix or bone. Note that nail product labeling is often consumer-driven and therefore can be confusing. For example, professional nail products marketed as cuticle moisturizers, softeners, or conditioners are actually designed for the PNF, lateral sidewalls, and hyponychium, not for the cuticle. Cuticle removers are professional products that, when carefully applied to the nail plate, can speed the removal of stubborn cuticle tissue. 100 Activity. Magnifying the nail. Use a small magnifying glass to examine the cuticles and PNFs of at least 5 friends or classmates. Observe how the thin cuticle tissue attaches to and rides on top of the nail plate as it emerges from under the eponychium at the nail plate's base. Then examine the PNF to see how it differs from the cuticle in appearance. Identify which one can be removed and which one should never be cut. Eponychium. The eponychium is the living skin underneath the PNF found at the nail plate's base covering the matrix area. According to research conducted by Doug Schoon in 2019, the eponychium is a thin section of tissue found on the bottom side of the proximal nail fold. It was discovered to be surprisingly thin, approximately 0.004 to 0.006 inch, 0.1 to 0.15 mm thick, and consists of only one layer of stem cells. The eponychium extends from the front edge of the proximal nail fold and stops at the nail matrix. The PNF is the section of skin over the eponychium. This skin flap covers the nail matrix and the nail plate. The eponychium is often mistaken for the cuticle. They are not the same. The cuticle is the dead tissue adhered to the nail plate. The eponychium is the PNF's underside and is the living tissue that makes the cuticle. As the nail grows, the cuticle completely detaches from the eponychium and becomes strongly attached to the new growth of nail plate. It is pulled free to form a seal between the natural nail plate and the PNF. Determining the difference between the cuticle and the eponychium is easy when you follow these simple checks. Is the tissue adhered directly to the nail plate but easily removed with gentle scraping? Is the tissue very thin and colorless but easily visible under close inspection? Is the tissue non-living and not directly attached to living skin? If you answered yes to any of the questions above, this tissue is called the cuticle. Is the tissue part of the skin that covers the nail matrix and lunula? If you cut deep enough into this tissue, will it bleed? If you answered yes to any of the questions above, this tissue is called the proximal nail fold, PNF. Cosmetologists can gently push back the PNF but are prohibited from cutting or trimming any living tissue, including the PNF. Even if this skin appears dry and hardened, it is part of the living PNF. Cutting any part of the PNF or other living skin is outside the scope of cosmetology nail services and is not allowed under any circumstances. Hyponychium. The hyponychium is the slightly thickened skin layer between the fingertip and the nail plate's free edge. It forms a protective barrier that prevents microorganisms from invading and infecting the nail bed. Treat this area gently because when it is damaged, the nail plate can separate from the nail bed, making infections under the nail plate possible. Specialized ligaments. A ligament is a tough band of fibrous tissue that connects bones or holds an organ in place. Specialized ligaments attach the nail bed and matrix to the underlying bone. They are located at the base of the matrix and around the nail bed's edges. Check-in 5. Name at least 5 basic parts of the nail unit. 6. Explain the difference between the nail plate and the nail bed. 7. What part of the nail unit contains the nerves, lymph, and blood vessels? 8. What is the difference between the cuticle and the eponychium? Low 4. Describe the factors that affect nail growth. Nail growth. The nail plate's growth is affected by nutrition, exercise, and overall health. A healthy nail plate grows forward from the matrix and extends over the tip of the finger. It can grow in various shapes, depending on the shape of the matrix. Figure 5.2. The matrix's length, width, and curvature determine the plate's thickness, width, and curvature. For example, a longer matrix produces a thicker nail plate, and a highly curved matrix creates a highly curved free edge. Nothing can make the nail plate grow thicker. This would require the matrix to grow larger. However, regular manicures, good nutrition, and keeping the cuticles moisturized help maintain healthy nails. The average nail plate growth rate in the typical adult is about 1/10 to 1/8 inch, 2.5 to 3 millimeters per month. The nail of the middle finger grows the most quickly and the thumbnail grows the most slowly. Nail plates grow more quickly in the summer than in the winter. Nail growth rates overall will decrease as you age. During pregnancy, nail growth rates increase dramatically in the last trimester because of hormonal changes. The rate decreases and returns to normal after delivering the baby. It is a myth that prenatal vitamins cause nail growth. A pregnant person's nail growth accelerates regardless. Although toenail plates grow more slowly than fingernail plates, they are thicker because the toenail matrix is longer than the matrix found on fingernails. Roofed flat acorn trapezoid olive date arched circumflex concave convex. Figure 5.2. Various nail shapes. Square angular narrow fan arched tubular nail plate malformation. The plate will continue to grow as long as the matrix is healthy and undamaged. However, the nail plate's shape and/or thickness can change because of damage to or infection of the matrix. Ordinarily, complete nail plate replacement takes about 4 to 6 months. Toenail plates take 9 months to 1 year to be fully replaced. Hair sheds automatically or periodically, but nail plates do not. As the nail matrix cells continue to proliferate and differentiate into specialty cells, they push the existing differentiated cells upward and away from the matrix. This causes the plate to flow slowly toward the free edge. If nail cells are produced more quickly, the plate grows more quickly. The reverse is also true. If a small portion of the matrix stops making new cells, the nail plate becomes thinner and develops a narrow groove. As a common part of the aging process, parts of the nail matrix begin to permanently slow down production, causing the plate to develop a series of narrow grooves running down its length. Figure 5.3. These grooves are often mistaken for ridges. The matrix does not grow any ridges in the nail plate, only grooves. Never file these so-called ridges, as this thins and weakens the entire nail plate. Figure 5.3. Check-in 9. What can help maintain healthy nails? 10. Why does the nail matrix produce grooves in the nail plate? Narrow grooves in